But let's be honest that you need some resources in order to ensure that children are properly supported, and schools are a really important place. And I'm going to reiterate the comments from the question that I asked the Minister when he joined us at the Select Committee. And I think this is a really important point. I think it speaks to the crux of the matter. My greatest concern about the Government's Green Paper and their plans from now until 2030 is that it's only going to replace what's already been lost, because the government has no idea, that there's been no assessment done of how many peer mentors we've lost in our schools across the country, how many counsellors we've lost in schools across our country, how many educational psychologists we've lost in schools across our country, how many pastoral care workers we've lost in our country, and how many school nurses. And that's just a reflection of some of the roles that I know from schools that are really passionate about their students' mental health, no longer have the funds to invest in those vital services. Again, I can reflect on the experience of schools in my own constituency where they had access to a service called Seedlings. And again, that service was pulled from all those schools, and only those that could afford it because they met the threshold of a certain number of children that met free school meals in order to access pupil premium, that they were able to afford it. But those schools that just fell below that threshold were no longer able to afford it. And that, combined with other cuts that we've seen, not just in our schools, but in our local authorities, to our children's centres, educational psychologists that were previously funded by local authorities, our Sure Start centres, our youth centres. It's not just what happens in school, it's what happens after school. We know for many young people, youth workers are the people they would turn to as a trusted adult if they were suffering with their mental health. The combination of all these things is the toxic situation we find ourselves in, where young people now are only seen when they're in a crisis. We have a system that's only geared to what we do when they're really in that crisis situation, and what we need is proper early intervention and actually prevention to keep our young people well. Schools cannot be expected to do it all. And again, from the evidence that we heard, it was very clear from teachers and their representations that they want to do everything possible to support their students in the classroom, but they have many demands made of them. The academic system, as it's currently presented, again, adds many pressures not only to the students but to the teachers themselves. We know that a staggering 81% of teachers have said that they've considered leaving teaching in the last year because of the pressures of their workload. And the combination of all those factors, for me, is every reason why I think it's not good enough to expect to have just one designated mental health lead in every school, one teacher that's trained for 2 days, that, as the government accepts in its own evaluation, will have an opportunity cost in terms of taking those teachers away from other activities that they are expected to do